chief of a lawyer to serve it for you? Is it just more fun?
I'm obviously prepared to consider something.
You have gonorrhea.
No, I don't.
Maybe you're right, but I have a lab result that says you do. Could be a false positive. Normally I'd run a second test, but since you're here, I'll just go for first.
You're just trying to scare me.
It's portable, you know? Public health issue. I'll be sure to let my wife know. Don't bother yourself. The state will call for you. Look, if you're clean, I'm sure it'll all blow over. No big deal. There's an easy way to find out. Your doctor's test. These are mine now. I'll see you in court.
West Nile negative. Not surprising since lots of many mosquitoes passing through Jersey in December.
No reason to neck one encephalitis.
I wouldn't believe this.
What's up?
How's it going? Father's not the father.
Do double.
That really is. The numbers on my area.
It's not a good idea to make a sign of this condition. We just want a second opinion.
I need an answer.
You lied. You didn't lie, Doc. You, on the other hand, accused us of molesting our son.
Perfect.
Could we get off my scoops and focus on theirs? Theirs is bigger. You're not Dan's parents.
He was adopted. He doesn't have it.
I do.
Adoption makes us just as much as...
When we were taking his medical history, were you confused? Did you think we were looking for a genetic clue to his condition, or did you think we were trying to ascertain who loves him the most in the whole wide world?
How did you find out about this?
He was taking the cafeteria.
You can't do that.
Again, why are we getting hung up on what I did? Your medical history is useless.
No, we gave you a detailed history of his biological mother.
Her history. Non-smoker, good health, low cholesterol, no blood pressure problems.
Dan was adopted 2 weeks after he was born. You have his history. There's nothing you need to know that we didn't tell you.
Sounds reasonable. Well, if you want to transfer your boy, that is your choice. I still think it's wrong.
Vaccinated? Biological mother. When she was a baby, did she get her vaccination? You know why kids get vaccinated at 6 months? Before that, they're protected by their biological mother's immune system. Was she vaccinated? Now, everybody thinks that's a regular old person. It's a rash. Extremely uncomfortable. Has a wicked fever. And lives. Here's the kicker. Once every million or so times, the virus mutates. Instead of Dan having a fever and a rash, the virus travels to his brain. It's a time bomb. In this case, for 16 years. Only 2 population concentrations. I know. There's been 20 cases in the United States in the last 30 years.
Suppose you can make an argument that this is still stage 1. Also, just believe versus stage 2.
Boom. Stage 2 is universally fatal.
I assume it's impossible to know when he might live in stage 2.
He's already started showing symptoms. Could be a month, could be tonight.
Can we prove it?
That's the neurologist.
I'm picking around the floor. Dr. Savasaki was trying to interfere without confirming his diagnosis.
What happened?
You won't get a reliable result from these antibodies unless CSF.
The wrong treatment kills any health. Why did it be like? But also kill him. They're all fine. I'm gonna have to biopsy his brain.
There's one other way. You sure this isn't going to Yeah. See, we go through the pupil. Like, you won't feel it. The eye's been paralyzed. The needle travels to the back of the eye, which is where we perform the biopsy on the retina. So we've confirmed that the problem is this mutated virus. The treatment for SSPE is intraventricular filler. Implanted on my reservoir under the scalp, which is connected to a ventricular catheter that delivers the antiviral directly to the left.
You want us to listen to this? I don't even understand what you're talking about.
The antiviral. Look, I'm sorry. I can explain this as best I can. The notion that you're going to fully understand your treatment and make informed decisions. It's kind of insane. Here's what you need to do. It's dangerous.
bet.
Should. We don't make that bet, the kid dies. Not for the paternity bet. I never would have taken their DNA. Without their DNA, we never would have discovered that Dan was adopted, which was the key to this case. You just don't want to pay rent. Big mistake. My guy knows a guy.
Fine. I will let you out of clinic duty for 1 week after you pay the $3,200 PCR test.
There's the 100 you owe me. 100 I won from Cameron. 200 I took for me. And 600 I got for Wilson. There we go.
Good news on the EEG. Treatment is working.
Your immune system is responding.
Also, just want to take a look. See what the learning heals can do. Name as many animals as you can. Let's start with the letter O.
Ostrich. Fox. Very good elephant.
Well, it's 2 better than last time. How are you doing with the whole adoption thing?
Been here since 5th grade.
How's that?
Except she. I have one. My dad doesn't. Looked it up on the internet. It's one of those.
That's right, it's autosomal dominant. Since neither of your parents have cleft chins, it's highly unlikely you're biologically related.
You sure you're okay?
I've got no problems with them. I love my parents. How's it going?
He's doing pretty well. He's a smart kid.
Wheels, mate, wheels.
I didn't sleep well last night. Woke up with a scratchy throat. I just don't feel so good. Cough. I have a bit of an upset stomach too. I think I'm running a fever. I'm worried I'm be contagious. Inventory. Tomorrow, I'm sure I'll be feeling better by then. Thanks, Mr. Nobby.
I cannot believe you just did that.
I really do have a cough.
Oh, so you weren't lying. You'd be curled up in bed with a bowl of chicken soup. Even if you didn't have a horny girl in your bed?
Yes. Because I really do. Hey, I really do have a cough.
You also have a little rash.
I'm not sure we should be kissing.
Oh, it's okay. Because I have almost no interest in kissing you. Okay.
Brandon, भगवान पास अब
I know I'm good, but come on.
भगवान पास अब पहुंच गया.
Brandon. Brandon. Brandon.
You're half an hour late.
Busy caseload.
One case is not a load.
So how are we doing on cockpit swaps today? If there's a cute shortage, I can run home.
No, you can't.
Nice. Hello, sick people and their loved ones. In the interest of saving time and avoiding a lot of boring chit-chat later, I'm Dr. Gregory House. You can call me Greg. I'm one of 3 doctors staffing this clinic this morning.
Short, sweet, grab a file.
This ray of sunshine is Dr. Lisa Cuddy. Dr. Cuddy runs this whole hospital, so unfortunately she's much too busy to deal with you. I am a board-certified diagnostician with a double specialty of infectious disease and nephrology. I'm also the only doctor currently employed at this clinic who's forced to be here against his will. That is true, isn't it? But not to worry, because for most of you, this job can be done by a monkey with a bottle of Motrin. Speaking of which, if you're particularly annoying, you may see me reach for this. This is Vicodin. It's mine. You can't have it. And no, I do not have a pain management problem. I have a pain problem. But who knows? Maybe I'm wrong. Maybe I'm too stoned to tell. So, who wants me? And who would rather wait for one of the other 2 guys? Okay, well, I'll be in exam room 1 if you change your mind.
Jody Matthews. Please accompany Dr. House to exam room 1.
Dr. Chase.
I'm not sure scaring your boyfriend is the best medicine for him right now.
I know, I get stupid when I'm scared.
I go rock climbing.
Look, I was wondering, before this happened, we were having sex.
What, you're wondering if whatever he has, you might have gotten it? It's unlikely. I mean, you ran a complete SCD panel, so...
No, I'm wondering if maybe I did this to him. That was kind of rough. It was yellow. It's not anymore.
It's a shame.
I thought that might be a problem, so I refused.
It's exciting.
I don't think it complicates things. Kidney failure was caused by the antibiotics.
Maybe.
Typically, Low blood pressure and abdominal pain means an infection. Abdominal infection causes sepsis.
Except we checked for cellular.
I know, but what if it's the other way around? What if the low blood pressure is causing the abdominal pain?
Viral heart infection. The intestines aren't putting enough blood and the result is belly pain.
I know it's not the same presentation,
It's a 10 million to 1 shot. But this what we dealt with here. It explains the cardiomyopathy, pain, fatigue, fever. You read the book. Impressive. It's a ludicrously long shot that explains every one of those symptoms. Like the pop and the rash. Should we just erase those?
anything can cause a rash.
Okay. Cardiac infection. Cameron, you thought allergy? Chase, what was it? Carcinoid? And then there's hypothyroidism. Could be parasites. Finally, sinus infection.
If you're gonna list all the things it can't be, you're gonna need more colors.
Cameron was right. No condition explains all these symptoms. But orange and green covers everything.
Orange and green. 2 conditions contracted simultaneously.
Occam's razor. The simplest explanation is always the best.
One second.
Pretty sure it is, yeah.
Baby shoes. Chase tells me the 2 people exchanged fluids. Night. Once.
Why shouldn't that be known?
Night. The 2 or the 1.
I think your argument is specious.
Why is one so lonely? Cardiac
We'll run the tests.
Test take time. Treatment. Start the kid on unison for the sinus infection and what's orange?
Hypothyroidism.
Hypothyroidism.
Not like this. Intravenous levothyroxine is an artificial thyroid medication. It should take care of it. Also, the nurses are going to start you on unison. It's a more targeted antibiotic.
For the sinus infection?
Yes.
And the other stuff is for something else entirely.
Bad luck, huh? Don't worry. He should be back to ditching work in no time.
Brandon?
How's he doing?
Brandon is
Mom? Dad? It's Mindy. I was gonna bring her home for Christmas. We're engaged.
So the family house is there.
2 odd conditions striking completely coincidentally at the exact same time.
phrase it quite that way.
Ready for the treatment?
They think we're doctors. They believe whatever we tell them. So, is that our job? Houses puppets? He comes up with an insane idea, we get to pretend it's not.
His insane ideas are usually right. We've been here long enough.
I've been long enough to have Stockholm syndrome.
What? Because we don't hate him? He thinks outside the box. Is that so evil?
He has no idea what the box is. If you guys think he's right, go home, relax. Just wait for the kid to get all better. I'm going to the lab to test for viral infections. Negative for contact.
Down about 5,000 to go. I really think we're going to come up with your mystery virus.
Way fun.
What are you doing? No, I mean, I know what you meant. We're waiting. My throat hurts. So you said. How long will we wait? 2 minutes less than when you asked me 2 minutes ago. Hi.
Hi, Dr. Cuddy. Nice to meet you.
Cuddy, thanks for the consult. His throat seems to have some condition.
Say He has a sore throat.
Yes, why didn't he? He said it hurt, and I rushed to do something.
Wouldn't want to prescribe a lozenge if there's any doubt about its efficacy.
Listen, I think I'm always right. And I realized that you're right. At least I think you're right. I really know now, do I? Hey, I'm here.
Go home. Drink some hot tea. Negative on parvovirus B19.
I'm impressed.
Really? What is this?
Mental doctors.
What about Chase?
Completely professional relationship with me, respect you as a colleague and a doctor. And you can't make it you without thinking sex.
Because I asked what kind of sex could kill you?
You now have total control of your relationship with me.
So a woman can't express her interest in sex without it being some professional power play?
No. You look the way you do, so you're aware of your effect.
Men should grow up.
Yeah, and God should stop looking at sex. It's not gonna happen. Carry on.
Yeah, what are you doing here?
Looking for you guys. Why didn't you page me? Because I didn't be here. You told me? No one. I assumed you're trying to do my crazy two-illness theory. So obviously you're gonna be in the lab. Spin the urine? Not yet. It's different types. I wonder if that's significant. It means the antibiotics didn't cause the kidney failure.
How'd you know?
You guys are so busy sleeping, you might have checked in on the question. You visited a patient, sitting by his bed all night, just so he knows someone was there for him.
I looked in on him. He's much better.
Ergo, the treatment's working. Ergo, be right if you will.
Hey, I'm glad the kid.
Smugness of yours really is an attractive quality.
Thank you. It's either that or get my hair hung out. Smugness is easier to maintain.
I get that you're not a big believer in catching flies with honey approach, but do you honestly think he'll collect a jar full by cleverly taunting you?
Flies, the doctor, sure. I'd say to form a nice cry was a great guess, but sorry, not this time. What do you think you're doing right now?
I think he'll be going home not feeling like a piece of crap. You want him to feel like a piece of crap?
No, I don't want him going home.
I'm feeling a lot better.
His fever's gone, his rash is gone.
See,
Is everything okay?
just ordering some tests. Absolutely nothing wrong.
How much longer?
30, she was on the 8th hole and I paged her. We got another.
I ran a TSH, T3 and T4. Patient's negative for hypothyroidism. Not talking about that.
Well, the fact that he's getting better would indicate the unreliability of the tests.
If I'm right, it's a viral infection.
One of two things always happen. Patient dies or the patient's immune system fights off the invader. What's with her?
Her leg hurts after running 6 miles. Who knows?
He's getting better. Why would you do your mind? Seriously getting better. It's not two illnesses. It can't be two illnesses.
So glad you work here.
If I'm right, the antibiotics are prescribed. Boxes, kidneys, and liver, impeding his ability to fight off the virus.
Well, that certainly would be a concern. What's the bus?
you have your phone with you.
Before when I was talking about when it's broken up and sex can kill you, I was just making a joke because I was uncomfortable.
What you said.
I'm uncomfortable about sex.
Well, we don't have to talk about this.
Sex could kill you. Do you know what the human body goes through when you have sex? Pupils dilate, arteries constrict, or temperature rises, heart races, blood pressure skyrockets, respiration becomes rapid and shallow, the brain fires bursts of electrical impulses from nowhere to nowhere, and the blood cell count is down, which means his body can't fight off infections.
He gets sick and die.
Sick. How sick?
He gets a cold, he'll die. Push the needle into your hip now. Take some of the neck. That was just the anesthetic. Cold biopsy, then. It's a bit over. Take a deep breath. It's just gonna hurt enough. The marrow makes the blood cells. Take a peek at it under a microscope. You find a viral infection. Something to explain why the blood count is so low.
¿Tú qué dabas, tío?
Answer.
Daru pique.
I can't stay here forever.
The patient could have died.
The one with pulled muscle.
Those symptoms are consistent with a dozen other conditions. I'm entitled to a consult.
You are not getting out of clinic duty.
You've got 100 other idiot doctors in this building who look warm and fuzzy every time they pull a toy car out of a nose. You don't need me here.
No, I don't, but working with people actually makes you a better doctor.
When did I sign up for that course?
When did I give you the impression that I care?
Working in this clinic obviously instills a deep sense of compassion. I got your phone number, right? In case anything comes up at 3 o'clock in the morning.
It's not gonna work. You know why? Because this is fun. You think it's something to make me miserable. I think it's something to make you miserable. It's a game, and I'm gonna win because I got a head start. You are already miserable. This is important. Oh, good.
But you I'm paying for her. The only people who can get
No,
here.
there is not. That's the love and hate. There is, in fact, a great wall of China with armed sentries posted every 20 feet between love and hate. 36 fighting.
Who's the patient?
I am.
You can't.
Dr. Wilson prescribing musician.
Yeah. You're lying, cheap, and steal. Yeah, but you're incapable of kissing a little ass.
We all have our limitations.
House. Wrong bottle. Look here. Take one of these, wait 5 minutes for it to kick in, and find Cuddy and kiss her ass.
What was the kid's first symptom? You did the history of his 800 symptoms. Which one hit him first?
Cough.
sulfuric acid crystals in the joints? Symptoms are pain, swelling, redness, stiffness. Not one of which do I see on that board.
Because he doesn't have gout. Every day, cells die. They survive because the remaining cells divide and replace the losses. But colchicine, a gout medicine, blocks mitosis and stops cell division. Which will result in abdominal pain, rash, nausea, fever, kidney failure, low blood pressure, and will also mess with the bone.
He doesn't have gout. Why would he have gout medication?
You guys were right. He didn't have two conditions at the exact same time. First, he got a cough. And because he's an idiot, he went to a doctor. In order to justify charging $200, that doctor felt he should actually do something. Oops. He wrote a prescription. 7,000 people die each year from pharmacy screw-ups. Not nearly as many as die from doctor screw-ups, but still, that's something they use in promotional materials. The pharmacist gave him gout medicine instead of cough medicine. And the only thing it wouldn't do absolutely nothing, to relieve his cough. Occam's razor. The simplest explanation is almost always somebody screwed up.
But once he checked into this hospital, he was completely in our control. Our food, our pills, our everything. So even if you're right, no more gout medication. It will either continue to deteriorate or he would have gotten better. But he got better and then he got worse. It doesn't fit. It doesn't make sense.
Okay, two people screwed up. Not as simple as one, but
He's resting.
I'm Dr. House, your son's physician.
You're the one we haven't met yet.
You're the one he hasn't met. How can you treat someone without meeting him?
It's easy if you don't give a crap about it. That's a good thing. If emotions made you act rationally, it would be called emotions, right? That's why we have this nice division of labor. You hold his hand, I get better. If I start tucking him in at night, well, it's not fair to you guys. If you start prescribing medicine, it's not fair to me. So what I want to know is, who stepped on my side of the net? Who cared enough to be stupid enough to give him his cough medicine?
When we checked in, Dr.
Tuesday, he's getting better. Wednesday, he's getting sick again. Somebody gave him his cough medicine Wednesday. Come on, nobody's gonna be mad. Just want to know who tried to kill the kid.
Dr. House, maybe we should
His throat is sore.
Page Dr. Ocker. We want to hear about this.
Sorry. I was coughing and I just wanted to help
Aren't
you.
you a dear? Where are the pills?
He took the last of them before he was switched into that room. All gone. It was just cough medicine.
No, it wasn't. Where's the bottle?
We need to know exactly what you put in this bottle. We think it was colchicine, a gout
If
medication.
the prescription said cough medicine, that's what I dispensed.
The family is prepared to waive liability, right? We just need to know what it was, what dosage it
It was
was.
cough medicine.
Refill.
He's gonna be okay. You don't know that. Does Brandon like that quality in you? You're a little negative.
Things don't always work out for the best.
Doesn't hurt to hope they do.
No. Not unless it makes you figure you can do whatever you want. Like give people cough medicine.
This is cough medication. It's what Brandon was supposed to get. It's small, round, and yellow. You need to understand that it's going to be a standard medicine manufactured over time.
They were small, round, and yellow.
Joseph has pronounced it.
Hey, I'm just a pharmacist, but I know what cough medicine looks like, doctor.
It's so perfect. It's beautiful.
Beauty often seduces us to the road to truth.
And tritoness kicks us in the nuts.
So true.
This doesn't bother you?
That you were wrong. I try to work through the pain.
I was not wrong. Everything I said was true. from smearing bone marrow sugar.
Screw the Texas. Do an exploratory laparotomy and find out what's in there.
He has no blood pressure, no immune system, and no kidneys. Surgery will kill him.
Yeah, you're right. Let's stick with the long pill theory.
Scheduling the surgery.
Sensors will give us information we need for the exploratory surgery later this afternoon.
Your fingers are numb. Try not to move. You're in the right atrium. Try not to catch the flow from the tricuspid valve.
Catheter is curling in the atrium.
Got it. In the RV now.
Dr. B, you must have irritated the heart rhythm.
It'll calm down.
You can't tolerate any cardiac arrhythmia. Pull back.
He needs the surgery.
Pressure's dropped.
You still with us, Brando?
It hurts.
Yeah.
Starting. Clear. Sinus rhythm.
I got a pulse.
Yeah, no surgery today.
How you doing?
Okay.
Great. I'm doing good too. Get to knock off an hour early today. You know why? I kissed my boss's ass. You ever do that? She just said yes, but she wants to reinforce that behavior. Wants me to kiss a lot of other people's ass. She wants me to kiss yours. What would you want? A doctor who holds your hand while you die, or a doctor who ignores you while you get better? I guess particularly something of a doctor who ignores you while you die.
There she go.
Think it's gonna come out on its own? Are we talking bigger than a bread basket? Because actually, it did come out on its own. Which were small stuff. Nothing. It's wrapped up in a nice soft package and plot. Big stuff. We're gonna rip something. Which, speaking medically, is when the fun stops.
How did you?
Been here half an hour, you can step down and it tells me its location. You haven't told me what it is. That tells me it's humiliating. You have a little birdie carved under your arm. It tells me you have a high tolerance for humiliation. So I figure it's not chemicals. I've been a doctor 20 years. Don't get surprised.
It's an MP3 player.
Is it because of the size, shape, or is it the pounding baseline?
What are we gonna do?
I'm gonna wait.
For what?
Okay, it's 3 o'clock. You tell Dr. Cuddy there's a patient in the exam room 2 needs her attention. And the RIA wants her to check her legal download.
Brandon's not ready for surgery.
Okay, let's leave it a couple weeks. She should be feeling better by then. Oh, wait. Which way does time go?
He crashed during prep. He's also experiencing pain in his fingers. Thinks some bug may have gotten in the femur. I think we should double his dosage of GCSF to temporarily boost his white blood cell count.
Pain in his fingers. All right. Hi again. Hey, how y'all doing? Interesting fact. Every 7 years, it's a whole new you. Inspiring that one, huh?
Dr. House, this is a clean room.
Yeah, I read the sign. Cells of different organs reproduce at different rates. So, your kidney every 3 years, your stomach lining every week. This is colchicine poisoning causes all these symptoms but not all at once.
Well, we went to the pharmacy. We saw the pills.
Colchicine does its damage in a very specific order. First of all, there's a pain in the abdomen, the rash, the fever. Isn't that what you got first? Then the kidneys go, which is exactly what happened to
Brandon.
right. Screws up your bone marrow. Then neuropathy. Painful tingling in the fingers and toes. And what do you suppose happens after that? Hair loss. The bad news is, your special boy is doing drugs.
No, he's not.
Ecstasy.
No.
You know what they cut that stuff with? Apparently colchicine. Unless you ingested the colchicine through your contact lens solution or skin cream. It's another drug you're lying about. I don't know how it happened. I don't care how it happened. It happened. Start,
Brandon.
lovely. Start Brandon on fab fragments. Get him some Tylenol for the hair I pulled out. Get some air in here. Make a note. Should never have gotten myself.
I think that would, you know, wouldn't hurt you to be wrong every now and then.
But you don't care about these people.
The colchicine interferes with the ability of the heart muscle to contract, pumping blood forward in your blood pressure. The antibodies we're giving you should neutralize the colchicine, allowing your heart to beat at its normal rate.
You know.
We know now.
Big weekend?
Not for me. I'm fully stocked.
How do you guys doing inventory?
Nope. Solve that kid's case.
The gout medicine OD?
Yeah.
The fact that I know it's a gout medicine OD would seem to indicate the case is already solved.
Well, you'd be wrong.
What about the fact that the kid is now evil? What's the concern?
You know how many forms of colchicine there are on the market? Neither do I. Pills, powders, liquids, IV fluids. Somewhere at a party, his coffee up his nose and his ear, this kid had some.
So you're not happy with your ecstasy kid?
He said he used it twice.
People lie.
If you lied.
You know, I'm not
Like serious?
just a little joke.
Right.
Temperature's normal.
Oh, cousin Sharon.
If we invite him, then we have to invite all the cousins. So what? My side of the story doesn't mean anything.
That's because I got some of those cough pills. was running the marathon last year.
Lucky you were there. Your daddy's sense of humor.
Hello. Say hi to Bear.
She's not even eating anything while she's spitting up.
Yeah, I'll come again. Sorry. Yes. Ask the pediatrician next time. I just delivered. She's spitting up.
Yeah, I'm sick of timing it down.
Lived on the water for 9 months. You'd have to spit up too.
Something wrong?
A little lethargic. We didn't think she's hot. Is she,
Is she alright?
Freeze.
You would consider going to a shrink. I would pay for it myself. A hospital would hold a bake sale, for God's sake.
We have an epidemic.
2 sick babies. It's very sad, but it doesn't prove an epidemic.
How many do? Get up. We're going hunting. What? Weapons. Hi. Bye. Screaming is fine.
Good baby.
Oh, sorry, wrong room.
We'll see you later.
12 rooms, right? That's it?
Yep. Definitely check the whole floor. Good news. No epidemic.
Tragic.
Hold this one. It's 3rd floor.
This inoculate infection is spread to the next floor.
We were just gonna call.
They get hot all of a sudden.
Yeah.
Excuse me. Hi. Intake set you up here?
Yeah, my wife's contractions
The
are less than.
intake messed up. I am very, very sorry. Nurse Albert will arrange for an ambulance to take you to Princeton General. Maternity ward is temporarily closed.
You have to leave?
Yes, I am very sorry.
Why are you doing this?
I'll be there very, very soon. Happy now?
No. But I am interested. Three sick babies and a 4th showing early symptoms.
How bad?
Spondylosis.
BP's plummeting. They're barely able to keep systolic up. At this rate, they could be dead today.
Where did this come from?
3 delivery rooms, 4 different maternity rooms, no common personnel, and no common equipment.
There's got to be something in common.
Yeah. That would be the difference between an epidemic and a coincidence.
I'm putting a team together. I'm gonna start swimming.
What's she gonna swap? Heavy respirators, sink, vent, drain the entire hospital. That'll take months.
Needle in a haystack.
It's worse than that. That was a needle or a needle.
Then why the other good baby?
Because the hospital is for the baby. Her baby's sick. If it doesn't solve this soon, her head's gonna explode. I don't want to get any on me. So let's figure out what's in the haystack. Differential diagnosis.
Parasite.
Spreading too quickly.
Next,
Virus.
Kids are too sick, and the
antibiotics, so we got something resistant. Usual suspects.
MRSA. It's always MRSA in hospitals.
patient whose prenatal care I've been taking on a couple minutes ago. First, I'll need one of you two guys to supervise.
Anything there?
Late lunch.
Let's have lunch for you.
God, these chairs are comfortable. We are condemned to useless labor.
Fourth circle of hell. Charting goes a lot faster if you eliminate all classic poetry.
Writing down what we already know to be read by nobody. I'm sure Dante would agree that qualifies as useless.
You're over 2 weeks behind in your charting.
Oops, I missed.
What are you, 8?
Could an 8-year-old do this?
Better stop or it'll stick that way. You have a patient in exam 1.
See, I'm off at 12 and it's already 5 off.
I've been waiting for you since 11.
Melancholy without hope. Circle is that. Hi. I'm Dr. House. It seems to be the problem.
Show him your hands, Augustine. It looks like stigma.
Must be all the talk around home and water cooling. Washing a lot of dishes recently.
I help out in the kitchen.
Anything new in the kitchen?
We just got a donation of saucepans and pots this week. I haven't packed some lunch though.
Should have spent your time saving souls. It's easier on the hands. This is contact dermatitis. I'm allergic to dish soap.
Nonsense. They've always used that soap. Why is there a problem now?
I've been a doctor for years. I don't have to keep assuring people that I know what I'm doing. A person can become allergic to substances that they've had repeated and prolonged exposure to. Good news is, free samples. Diphenhydramine is an antihistamine. It'll stop the allergic reaction. Take one every 8 hours. I think you feel a little sleepy. And get some of that over-the-counter cortisone.
Thank you.
You want some water?
I have some tea.
Just relax for a few minutes. Stuff works pretty fast.
Still out by 12.
How do you solve a problem like dermatitis?
Doctor, I want to thank you for your patience.
She talking to you?
I don't know. She's certainly looking at me.
Oh, it's good to get a secular diagnosis. The sisters tend to interpret their illnesses as divine intervention.
And you don't? And you're wearing an awfully funny hat.
Excuse me.
If I break my leg, I believe it happened for a reason. I believe God wanted me to break my leg. I also believe He wants me to put a cast on it. Doctor, something's wrong.
Lift up your chin. You're having an asthma attack. I need you to relax. Roll up your sleeve, please. If you have an effort, open your lungs and help you breathe. Take a breath.
Yes.
Probably an allergic reaction.
Is he allergic to an anti-allergy medicine?
There's somebody out to get her. How are you feeling? Trying some steroids instead. It's called adrenaline. Makes your heart beat fast. Not this fast. Get a nurse, please.
Somebody help us!
Somebody get in here! Call Cole's in charge of the defibrillators. That means call
allergies and prescribed antihistamine. She went into respiratory distress, and he injected her with epinephrine. Presumably 1 cc.
0.1 cc. That is the standard dose that I gave.
People that go into cardiac arrest with 0.1 cc epinephrine.
She must have a pre-existing heart condition that got exacerbated by the epinephrine.
It's too bad you didn't make a notation in the chart.
I can make it up right now.
The drawer has syringes with both dosages. You could have easily reached for the wrong.
But I did.
Everyone makes mistakes. This is why doctors pay for the nose for malpractice insurance.
Sue. Worst they do is whack my hand with a ruler.
And the discipline board, are they going to whack your hand too?
You're going to report me?
Which waste way?
How about not report me?
I can justify keeping her here for a 24-hour observation. If you haven't found an underlying cause for the cardiac arrest by then, I will have to refer it.
There's no history of fever. Results from CBC didn't indicate an infection.
His cynicals were mildly elevated. Several of it could be looking at systemic allergic
It's not allergic. Allergies don't cause cardiac arrest like this. With the inflammation of the blood vessels.
Vasculitis? That wouldn't give you an elevated eosinophil.
Church-Strauss vasculitis group. Blood vessels in the heart, as well as the skin become inflamed, causing the asthma, rash, and heart problems. Covers all the symptoms.
You need a biopsy to diagnose.
Just say to you, be quick. If the lady just came off a rash.
What the hell are those?
Candidates?
Candy canes? Are you mocking me?
No. It's Christmas, and I thought,
Relax.
Isn't the prognosis for Church-Strauss a bit grim?
yeah. Untreated, only 33% of patients survive past a year. Treated 5 years.
Any other attempt after, I'd say that you made a mistake and gave it to each other. Saying you wouldn't say it was my mistake is saying it was my mistake.
Everyone screws up. You're right. I think you fit within the subset of everyone.
I didn't screw up. Order a chest CT and start the sister on prednisone, 40 milligrams TID.
The system. What did I mention?
Patient's a nun. Sister Augustine.
Thank you, honest.
Who doesn't?
Sister Augustine? We were trying to see if this is the bed control. Oh, this was the bed control. Oh, yeah, it's the bed control. I'm Dr. Cameron. This is Dr. Chase and Dr. Coleman. I've seen television in over 20 years.
Do you consider it the work of the devil, or do you just know what cable where you live?
How you feeling, sister?
I seem to be a little better. They gave me some medication.
Prednisone. It's a steroid to help with the inflammation.
Has Dr. House figured out what I have, or are we okay? I'm not sure what's wrong yet. I'll have a chest CT scan this afternoon, then I'll diagnose. Dr. House has given her medication, and he doesn't know what she has.
He doesn't know what he's doing. The only problem that woman has is that House grabbed the wrong syringe.
You don't trust him?
I don't trust a man who won't admit he might be wrong.
What?
I noticed she weren't so quick to tell her she's got
Spending for clinic duty.
She doesn't confuse making a mistake with being incompetent.
And here we go. Lessons. I recognize that confidence is not my short suit. I also recognize that I am human and capable of error.
So you might have screwed this up?
No.
So it's really a theoretical capacity for error.
Good point. Maybe that's my error.
You know, most people who think as much of themselves as you do like to talk about themselves.
People don't like to listen. So what's wrong with you? Let me guess. Inflammatory bowel.
Yeah. Is it that bad?
Yes. It's also written on your chart. Bloody diarrhea, gas, pain, simple salazine, but it didn't work.
Then I
Tried steroid MS, oral corticosteroids, 5-ASA, cipracantipurine. Unimpressed?
my medical history.
And how well your last doctor charted.
It's one thing to have to go to the bathroom every hour, but when the kids sit on my lap. The store sent me home, they're gonna fire me. Can't be back on 5 a.m. Maybe it'll work this time.
You
this?
Cigarettes. One twice a day. More or less. Studies have shown that cigarette smoking is one of the most effective ways to control inflammatory bowel. Once it's been well established that you're 30% cooler.
Are you kidding me?
About the looking cooler. Yeah. The rest is true.
Isn't it addictive and dangerous?
Pretty much all of them are prescribed addictive and dangerous. So this one's is completely legal.
I was talking to the nurse. Arsenio, do you know him?
Not really.
He can take pictures with his phone.
Cool.
That woman from the lab was interesting too. She studied astrophysics before becoming a nurse.
You know stuff better than I do.
Well, I'd love to hear all about people.
Yet you live in a monastery.
It's where I serve our Lord and the world best.
Our world, maybe. The rest of the world, on the other hand, probably get more out of feeding the homeless or
Getting the sick.
that's an exception, yeah.
Do you always want to be a doctor?
Always. You always want to be a nun?
My parents died when I was 6. I was raised in a foster home run by the church. When I was 18, I went to the monastery where they let me take my vows. I've known no other life and I haven't wanted to.
Hey, sister. We need you to lie as soon as possible. If you get scared, just let us know.
When I said, I'm inside the whale, I lost all hope. I turned my thoughts to the Lord.
Yeah, she's got God on her side.
You believe in God?
Not even a little agnostic.
Someone arrived in there this morning. We cleaned it up, but
It's normal, sister. It's just a few more minutes.
a higher order that's in control of what happens, but not from one anthropomorphic entity called God that's concerned with the everyday workings of you and me.
How much is in control of what the everyday workings of people?
It's about you, Foreman.
What are you talking about? The trees, the fish? They be the ones who think all about that? What about you, Chase? You believe in God? I believe Sister Augustine has no vascular pathology, which means no choked strap. His house made a mistake.
No, not necessarily. It could be something else. Neurotoxicosis or carcinoid.
I can get you. You don't believe in God, but you're willing to put complete faith in one man? Let's get her out of there.
Let's get her some Ativan. Smells
Which is very symptomatic temporal lobe swelling. We don't want to. Tell me get on her side. Religious visions in Mexico's. Patient tested positive for herpetic encephalitis. So what's that tell us?
Oh, I know. Prednisone compromises the immune system. Isn't that the medicine that you gave for that pain she doesn't have?
Yeah, but hey, I'm thinking that's a trick question.
Her immune system is severely compromised. 2 doses of prednisone wouldn't do it. Are you pending your diagnosis on an outfit?
In 10 seconds, I'm going to announce that I gave the wrong dose in the clinic.
Admit negligence?
Unless you leave the room. If you stay, you'll have to testify. 5. So there it was, in the clinic, drunk. I open the drawer, close my eyes, take the first syringe I can find. So, what are the options for compromised immune system?
Mixed connective tissue disease. It'd explain why she was feeling better on the prednisone.
Sure, she was feeling better right up to the moment it almost killed her.
And it explains the symptoms. Swollen hands, pulmonary problems, cardiac problems, it all fits.
Except her A&A was wrong.
So redraw the blood.
The treatment is corticosteroids, prednisone. And we can't go there because of the encephalitis.
We'll treat it with something that modulates the immune system that doesn't suppress it. Hyperbaric oxygen.
There's no protocol for putting a patient in a high-pressure oxygen room to treat autoimmune problems.
Oh, this with the protocols. Prep the nun. Discontinue the prednisone. I am both amused and annoyed. I think I should be less stubborn than you are.
You are aware of the Hippocratic Oath, right?
It starts first, do no harm, and then goes on to tell us no abortions, no seductions, and definitely no
Oh, yeah, took a read once, wasn't impressed.
Hyperbaric treatments could cause oxygen toxicity, lung and eye damage.
Every treatment has its dangers.
Which is why we only treat if we're convinced the patient actually needs the treatment.
I'm convinced. You're not. Question is, what are you gonna do about it?
I've been opening Thursday at 3. Do the 4th? Is it any good? Can I call you right back? What's up?
The pressure will force the oxygen into your system, saturate your blood. It will enhance white cell activity, reduce the inflammation.
And that will help with this mixed connective tissue disease.
We'll be doing about 10 treatments and then we'll reevaluate.
The last treatment with prednisone causes seizures, right? Confident this doctor talks about that. You reacted so strongly to the prednisone. Let us know that you had that problem with the immune system. I guess it was against of sorts. This is the chapel. A house of prayer.
House of prayer. That explains the good reception. Also, why nobody's ever here.
I need to talk with you, Dr. House. Sister Augustine believes the things that aren't real.
Job requirement.
She's putting me into a lab to get sympathy. She's a hypochondriac.
So, warning me that treating non-existent ailment.
Sore throats, joint pains. There's always something wrong. And there's never reason for it. Mother Superior plays right into it. That's Augustine on work duties. Treating her as fragile, special.
Not to make you angry.
Bothers me. It's not really in Augustine's best interests.
What's up?
I shouldn't.
I guess you gotta be good at reading people, be a good infirmarian, you know? So, pride and empathy. Look, in short, I was 7 deadly sins in under 2 minutes. People keep records of these things because they're Catholics.
They say you have a gift. And talk to him on purpose. You make jokes because you're afraid to take anything seriously. Because if you take things seriously, they matter. And if they matter,
When things go wrong, I get hurt. I'm not tough, I'm vulnerable.
I really know you. And I don't know if I'm right. I just hope I am. Please, Barry,
Well, thanks for treated for so long, it's got this simply dry, scratchy throat allergy that's whopping out to kick your ass out, compromising her immune system, diminishing her ability to heal, and breaking down her organ system. So, what's the source? The dish soap. No. Symptoms persisted days after the dishwashing episode. It's got to be something she's been exposed to here in the hospital as well as the monastery.
What about the tea? It caused her arrhythmia.
Yeah, it could be, but it's not definitive.
Skin test for allergies.
Not yet, she's too reactive. She's positive for everything. We need to stabilize her, isolate her from all possible allergens, give her system a rest.
Get her in a plane run.
Gradually introduce allergens and see how she responds. When she reacts to something, we'll know that's what's killing her.
I'm afraid not. This room has filtered air, filtered water, even have silk sheets. They're very decadent and hypoallergenic. You should be feeling better.
We'll be back to check on you. It'd be better if you don't have witnesses. Unless we ask them what's causing your allergy, then we can maybe move them along. I like it.
What is it?
I was in seminary school. They asked us once what our favorite passage was. I chose 1 Peter chapter 1, verse 7. These trials only test your faith to see whether or not it is strong and pure. Your faith is being tested. This fire tests gold and purifies it.
Your faith is more than precious to the Lord than your gold. So if your faith remains strong after being tested, it will bring you much praise and glory and honor on the day of his return.
He hasn't left yet. The only thing will break you knowing he's there is your fear, not a choice. Faith and fear. That's the test.
Choosing faith doesn't mean that we die.
But we expect to have an experience your death. Yeah. It's up to you.
Why did you leave seminary?
The nuns would agree with you on that.
I just wanted to say that I know that you did everything you could.
I don't need verification from you to know that I'm doing my job well. That's your problem, not mine.
I was just being nice.
You don't need to always do that.
Merry Christmas.
Sister Augustine's been next to you.
Good.
She's requested to check out against medical advice. She wants to go back to the monastery.
Talk her out of it.
I think I may have talked her into it.
Room's paid up for the rest of the week. Might as well stick around.
This illness is a test of my faith. This is going to take me where I am. I can accept that.
Does anybody believe anything you say? You're not accepting. Running away. Just like you always do. Ran away from the monastery, getting laid. Ran away from the real world. Getting laid didn't work out so good. Now things aren't working out again, so off you go.
Why is it so difficult for you to believe in God?
What I have difficulty with is the whole concept of belief. Faith isn't based on logic or experience.
I experience God on a daily basis. And the miracle of life.
Now things aren't working out again. Ran
Run away from the monastery, get laid. Run away from the real world when getting laid didn't work out so good. Now things aren't working out again, so off you go.
Why is it so difficult for you to believe in God?
I have difficulty with is the whole concept of belief. Faith isn't based on logic, on experience.
I experience God on a daily basis. And the miracle of life all around. The miracle of birth. The miracle of love. He's always with me.
Where is the miracle in delivering a crack-addicted baby? And watching her mother abandon her because she needs another score. Miracle of love. You are over twice as likely to be killed by the person you love than by a stranger.
Are you trying to talk me out of my faith?
You can have all the faith you want in spirits and the afterlife, and heaven and hell. But when it comes to this world, don't be an idiot. Because you can tell me that you put your faith in God to get you through the day, but when it comes time to cross the road, I know you look both ways.
I don't believe he is inside me and is going to save me. I believe he is inside me whether I live or die.
You might as well live. Got a better shot betting on me than on him.
When I was 15, I was on every kind of birth control known to man. And I still got pregnant. I blamed God. I hated him for ruining my life. But then I realized something. You can't be angry with God and not believe in him at the same time. No, not even you, Dr. House.
How'd it go?
She has God inside her. Been easier to deal with a tumor.
Maybe she's allergic to God.
Looked everywhere for an allergen that could be causing this reaction except one place, inside her.
Well, medical history, she didn't mention any surgery.
She had one.
Can we get the records? What hospital was it
They
at?
didn't have it at a hospital. Order a full body scan.
What if she refuses?
Tell her I'm looking for a miracle.
No piercings, no fillings, no surgical cleanings in the arm, no implants.
It's plain as a whistle. What's that looking for?
What is that?
Don't know. Mark on it. Get a 3D representation.
Oh my God.
The copper cross, form of birth control, pulled off the market in the 80s.
So she's allergic to copper.
Rare, but it happens.
Didn't she know she had an IUD?
She had an abortion. IUD must have been left in, embedded in the endometrial tissue where it couldn't be detected.
So all we have to do is remove the IUD.
Then the symptoms should subside.
I got this IUD when I was 15. It's been more than 20 years.
Or prolonged exposure to an allergen with minimal symptoms. But at some point, all it takes is one last contact to cause a full-blown reaction. It's like a balloon filled with air, one last breath. It explodes.
The first time I got the rash was when I was washing the copper cookware.
And all your subsequent symptoms came from ingesting food prepared in it.
Dr. House found his miracle.
I doubt he'll interpret it that way.
You told me your favorite passage. Would you like to hear mine? Celebrate and be glad, because your brother was dead and is alive again.
The prodigal son.
He'll be waiting for you when you're ready.
We'll schedule your surgery for tomorrow.
The sixth circle of hell.
Confined in a sweatbox with a bloody nose and all the tissues are soggy.
I think that's the seventh.
No, seventh is
God, you
when
must be fun at parties.
I think we both know the flaw in that theory.
How's the sister?
Heart rate is normal, kidneys functioning. You know how it is with nuns who take out their IUDs, they just bounce right back.
Great.
Told you I didn't screw up.
You screwed up.
I gave her 0.1 cc of epinephrine.
Yeah, and if Cuddy hadn't taken you off the case, you would have killed her.
Want to come over for Christmas dinner?
You're Jewish.
Yeah, Hanukkah dinner. What do you care? It's food, it's people.
No thanks.
Maybe I'll come to your place.
Your wife doesn't mind being alone at Christmas.
I'm a doctor. She's used to being alone. I don't want to talk about it.
Neither do I.
You did good with the nun. Congratulations.
Thank you.
Merry Christmas, Dr. House. Dr. Wilson.
Good night. That was sweet.
Take a look at this.
Mom, it's okay. You alright?
Actually, before she signs,
I killed the cat. Lots of blood.
It's okay.
I have a couple of questions about some of these dates. The first diagnosis
Schizophrenia. Dr. Walters, May 11 last year. The letter's in the medical file.
on April 6th. That was the last day she worked. But she received unemployment benefits for that week.
We fixed that. I know we did. We returned the money. That's the canceled check, not the real one we don't take.
And you're the dependent.
No. That's my little brother. I'm 18, just helping out.
You're all set. Just need a signature.
Hey, I'm talking to you. The cat's first. Now it's your turn, Lucy. Shut up!
It's okay. She just needs a little water. So
I'll go get it.
just hold on, okay? Just when she comes back, sign it. We're gonna be done. We need this, okay? Please. The voices aren't real.
Dr. Gregory House, please call Dr. Cuddy at extension 3731.
This is a good hospital?
Depends what you mean by good. I like these chairs.
How is she?
Stable. Okay. Your mom had a small pulmonary embolism. Blood clot that got stuck in her lungs. Blocked the oxygen.
But the pain started in her leg.
Where the clot started, her calf. That's called a deep vein thrombosis. Basically a bigger clot.
It never hurt there before. I would have noticed.
A piece of that broke off, went up the vein through her heart, and blocked the blood flow to her lungs. No blood flow, no oxygen. Is your dad here? I have some things I need to talk to him about.
My dad's running a little late. He's dead. Just talk to me. I'll take care of him.
All right. Your mom's blood alcohol was 0.12, 10:30 in the morning.
I gave it to her. 2 ounces of vodka. It cools her out. But that's first since Monday. That was 3 days ago. I've been real careful. She hears voices.
She's schizophrenic. Explains the DVT. The alcohol makes her pass out. She's immobile for long periods of time.
That doesn't happen. She's not an alcoholic.
She only drinks when you give it to her. We put her on blood thinners. You can probably take her home tomorrow.
It's not the alcohol. It's got to be something else.
Of course it's the alcohol. Hello! This guy's a professional doctor. Plays golf and everything, I bet. He's not going to tell you your mom's an alcoholic without proof. I'm sure he scoped the varices, checked her esophagus, ran all kinds of blood tests. Doctors like this, they don't make assumptions. They do the work.
I'd be happy to refer you the case, Dr. House. You seem so interested.
What case? It's over. Sending her home. How old is she?
You're a doctor?
On my own stethoscope. Did I ask you how old she was? I forget. A 38-year-old woman with no previous symptoms or history presents with deep vein thrombosis. How did she get it?
Oral contraceptives, smoke.
Hello.
Yeah, phone करो.
She's 20 years too young to get a deep vein thrombosis.
I treated a 12-year-old girl once, a soccer player. She got kicked in the leg.
There was no trauma, none of the risk factors.
You took a history.
I have some notes. They're not mine, but reliable, I think, for the purposes of this discussion. As for the immobility, well, she's real active right now, of course. Paranoia keeps her limber.
Paranoia?
Oh, yeah, she's schizophrenic. And her kid wrote this, so it might be a little biased. Having to take care of this nutso mom and all. You think there's a connection? Do we include schizophrenia before we take the DVT? The answer is no. Abnormal dopaminergic pathways in the brain do not cause blood clots. Schizophrenia is not the cause of DVT. On the other hand, we don't really know anything about schizophrenia, so maybe it is connected.
Well, schizophrenia explains one mystery, why you're so fascinated by a woman with a bump in her leg. It's like Picasso deciding to whitewash a fence.
Thanks, I'm more of a Leroy Neiman man. And it is only about the DVT. She's 38 years old.
Well, I solve this one and you're on your way to Stockholm.
We don't even know how to treat it. Come on, fumigation of the vagina?
A little louder, I don't think everyone's heard
2,000 years ago, that's how Galen treated schizophrenics. Marcus Welby of ancient Greece.
Well, clearly you're not interested.
Oh, I'm interested. I'm interested in how voices in the head could be caused by malposition of the uterus.
Is a better place for it?
And now what do we got? We got lobotomies, rubber rooms, electric shocks. My, that Galen is so primitive.
Where are you going?
I want to see the patient. That all-important human connection. Thought I'd give it a whirl.
You won't talk to patients because they lie, but give you a patient with no concept of reality.
It wasn't for Socrates, that raving, untreated schizophrenic. We wouldn't have the Socratic method, the best way of teaching everything, apart from juggling chainsaws. Without Isaac Newton, we'd be floating on the ceiling.
Dodging chainsaws, no doubt.
And that guitar player in that English band, he was great. You think I'm interested because of the schizophrenia?
Yeah, I'm pretty sure.
Galen was pretty sure about the fumigation thing. Pink Floyd.
This is Dr.
Gregory House. Nice to meet you. It'd be all right if we spoke alone for a while.
Well, you're gonna need me to...
Got your case notes, Doctor. There's a cafeteria downstairs. Get yourself whatever you want, as long as there's enough left over for a Reuben sandwich, dry, no fries, hold the pickles. Should run you about $5.80 with tax. I'll pay you when we're done.
No. Pickles.
Nice kid. How much do you really drink?
I was really talking to a patient. I don't know who I am anymore.
It's a blood clot. What's so fascinating about that?
He likes crazy people. Likes the way they think.
They think badly. That's the definition of crazy. Why would he like it?
They're not boring. He likes that.
And meds?
Baseball. I like baseball.
Very nice.
Very sad. My boy and me, we went to see a game.
Not meds. Meds. Medicine. You take what he tells you to take.
No one believes me.
I do.
I thought he liked rationality.
He likes puzzles.
Patience of puzzles.
You don't think so?
I think that people.
Yeah. Well, he hates them, and he's fascinated by them. Tell me you can't relate to that sentiment.
You told Luke it never hurt before.
Just rough. They didn't hurt.
Didn't.
Don't lie to him, Libby. Lively Lucy never lies to Lucas. Look what I do to him.
Learn anything from the human connection?
Yeah, the Mets suck. Also, for the last 2 months, she hasn't shaved her legs. Because of the tremors, she cuts herself.
The tremors aren't new. She must always cut herself.
Exactly. Something changed in the last 2 months. I'm thinking the amount of blood when she cut herself. So let's start with some blood work. Collect and send for clotting studies, PT, PTT, factor V, protein CNS, the whole shebang.
Good luck.
No pickles, and it's cold now.
If it's a Reuben, that's the way he likes it.
Everyone, this is Luke.
Allison, Cameron, it's nice to finally meet you.
Yeah, save it. We're busy. Luke, give us another half hour with your mom. We need to do some tests. Nice kid.
Take her off the psych meds. That way we'll know what's what on the physical side. Who knows, we might get more out of her. Don't worry, no pickles.
Happy birthday.
Okay. Oops.
I was going through your mail and it was on a form. Happy birthday.
No, no blood. Not mine.
For the test, Dr. House told you.
You're gonna steal it. Sell it. No. No blood. No. No blood. No. No blood.
Now 5 milligrams stack.
No. 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 Oh, no. Oh. Oh.
Well, good news. The lab says it's not strep, so we're done.
Wait a second.
No, really, not strep. Boys in the lab, sure, hard drinkers, but they're pros, you know. Plus, your kid actually has none of the symptoms for strep. I just figured it was quicker running the test than arguing with you. My point is, go.
I just wanted to ask your opinion, doctor. She's having a birthday party next week, and she's upset that I'm getting a sugarless cake.
The other kids hate it.
This is why you're here.
Sugar is the leading cause of obesity in America.
You want a doctor to scare her about the dangers of sugar.
She needs to get her weight under control.
Well, you know, I feel sorry for those other kids, Wendy, who don't have a mom like yours, a mom who knows that sugar causes heart disease, appendicitis, and athlete's foot.
Well, that's not fair.
Oh, yes, it is. No, I get it. You want her to slim down a little so she can wear pretty clothes like yours. Love the bracelets. Hey, what about matching outfits? You could be twins. She can't be your daughter. It's impossible. You look way too young. Happy birthday. Give the kid a damn ice cream cake.
You drugged her.
Actually, I didn't. I've taken her off all medication.
Your guy Foreman gave her Haldol.
He needed blood for tests. I assumed that was the only way to get it.
He knocked her out.
Look, I have a cane and I know how to use it.
I hired you. You work for me.
Okay. Can I go now, boss?
The Haldol changes her. She says it makes her soul numb. Don't give it to her. If there be rags enough, he will know her name and be well pleased remembering it. You okay?
Old days.
For in the old days, though she had young men's praise and old men's blame, among the poor both old and young gave her praise.
So, when I said no psych meds, I'm just curious, which word didn't you
The
understand?
Haldol had nothing to do with the bleed. You know that. I used it purely as a chemical restraint.
Oh, great. Well, that's good to hear. So she won't experience any of those pesky little side effects you get when your motives aren't pure. Oh,
Those side effects are so rare.
passing out, increased confusion, depression, that's not going to happen. That's not going to screw up our diagnosis because you just used it to restrain her. I'm so relieved.
She spit in my face.
Oh, it must have been so frightening for you.
What was I supposed to do? Tie her down?
Yeah, anything but give her drugs. That's basically my point.
Closing studies. Pretty fast. You promised to take the entire lab.
No, I saved that for emergencies. Told him she'd let out 2 units, and if it happened again, she'd die.
If it had happened at home, she would have died. The ER doc, he was going to send her home.
It turns out your best judgment is not good enough. Here's an idea. Next time, use mine.
I think they're choosing Rui.
Why did the patient bleed out?
The clotting studies so far are normal.
Well, cover your ears if you don't want me to spoil the ending. Everything was normal, except for prolonged PT time, which means what?
Usually it means whoever drew the blood didn't do it right.
Oh, that's right, because you drew the blood. And an ultrasound of liver. Let's find out who's right before she bleeds to death.
House says the kid's sensitive. Guess he takes good care of her.
If we don't find anything, why let him know we did it in the first place? What's the point? Why not just make old Foreman lift the key from the kid's backpack?
Luke sleeps in the living room.
Nothing in there. He lays out her clothes.
Enough organisation, enough lists. I think we can control the uncontrollable. Fix her meds, fix her clothes. Maybe you can even fix her.
Pick that up on your psych rotation?
Tried fluoperazine, Thorazine, Fosaril. I tried everything. The Ampicillin. Never touched it.
There goes Cameron's theory.
God, I hope it's not a vitamin K deficiency.
And breakfast, lunch, and dinner. House was right.
That's the only thing she'll eat.
Yeah.
problem is, you can't actually live on this stuff.
I checked it out. I looked on the box. All the nutritional values are solid. There's plenty of protein and calories.
Yeah, vitamin A and C, but no K. That's why your mom got sick.
So what's the plan?
Load her up with vitamin K.
That's it?
All checks out. Take her home in a couple of days. Feel like you're upset about something. You're gonna open up to me now, aren't you?
It's all my fault.
Here we go. Okay, I'm gonna say this once. You have done a very good job taking care of your mother. This was all she'd eat, then what else could you do? Gosh, just being a kid is a full-time job.
Shut up. I'm 18. I should be able to take care of my mom. I almost killed her.
Good example. Just the time it takes to express those ridiculous, self-centered teenage ideas. I don't envy your schedule. Close.
My mom doesn't like me either.
Smart woman.
Before she got sick, I didn't like how bossy she was. Always telling me what to do, the right way to do it. Never thought I missed that.
Should get that looked at.
Still don't buy a vitamin K deficiency.
House was right. That usually makes you happy. Less work for us.
The kid feeds his mum a steady diet of booze, and the problem is too many burgers.
The kid's in a tough situation. You do what you gotta do to survive.
Feeding alcohol to an alcoholic is not a survival technique.
Where I come from, if it works,
Yeah, right. I'm rich. I couldn't possibly understand what this kid is going through. Just because you're drinking pricier stuff doesn't mean you don't have a problem.
you seen someone stack down that road?
No way vitamin K's the whole story.
It's not broken. If you know how to read it, it can tell you how old someone really is. Exactly how old.
Great.
Not even 15. Almost, though. 2 weeks away. Maybe a month.
Last week. I was 15 last week.
Happy birthday to both of us. If you're gonna lie, though, go big. Go 21. That way you won't need your crazy mom to help you buy vodka.
Great. Thanks for the tip. Now, when I bring my mom home, is there anything I need to know about taking care of her?
I suppose your biggest worry is the booze. You're 15. Basically no mom. Child welfare let kids get away with that. Well, they wouldn't need those nice foster homes, and that would make them sad.
They'd put her someplace too. My life is working.
Not the word I'd use. Most 15-year-old kids are doing what they're supposed to be doing. You know, they're huffing glue, catching crabs.
If you turn me in, I'll sue you. That's privileged information.
Don't relax. It's not even your x-ray.
She's awfully calm.
How's right you? What is it?
There's a little bit of not enough.
Cirrhosis. But she doesn't drink.
Congratulations, you win. Actually, no one wins.
Well, if we're lucky, just long enough to fool the surgeon.
Good morning, Dr. House.
Good morning, Dr. Cuddy. Love that outfit. Says I'm professional, but I'm still a woman. Actually, it sort of yells the second part.
Yeah, and your big cane is real subtle, too.
Gotta go. Those running noses aren't just gonna start walking on their own.
The clinic can wait.
How long? Maybe we could catch a movie.
You should know by now, my doctors have no secrets from me.
I don't believe it. Who came running to mommy?
It doesn't matter here. The point is I know exactly what you did.
You have no idea what I'm talking about.
Somebody knows about a bad thing. You get there? Presumably hospital business. How many patients can I run?
She found out about my birthday. birthday, and I thought she told you, and I'd have to stand here and smile while you gave me a sweatshirt or a fruit basket. You know, made me feel that deep sense of belonging.
Actually, I was just gonna remind you, you owe me 6 clinic hours this week.
Oops.
Hi, this is Dr. Cuddy. I need all the charts on Dr. House's current patients.
I've tried everything. Mm-hmm. Pulling the tongue, ice packs on the throat, hitting yourself, the groin pinch. Well, you've certainly covered all on normal medical basis. How are you hitting yourself, though? Is it an open hand or fist? Open hand. Well, that's how they teach you at Harvard Med. How hard? I'm sorry, I missed that. Could you do that again? That's very good. Hiccups.
I need to speak with you now.
Mm-hmm. Well, I need to go pee-pee. Just dial it up a notch and repeat. I'll be back. Girl in the boys' bathroom. Very dramatic. Must be very important what she has to say to me.
Yesterday, your patient's tumor was 5.8 centimeters. Today, it's 4.6. How does that happen?
I guess I'd say Dr. House must be really, really good. Why am I wasting my hiccups? I wash before and after.
You also requisitioned 20 cc's of ethanol. What patient was that for? Or are you planning?
I got all focused on her right to live and forgot you do what you think is right.
You really didn't know?
No, I didn't. And frankly, I'm angry. Which I'm guessing is the correct response. Of course, I'll know better once you tell me what you're talking about.
Your birthday.
Well, anger was a bad guess. Well, normally I'd put on a festive hat and celebrate the fact that the Earth has circled the sun one more time. I really didn't think it was going to make it this year. But darn it, if it wasn't the little planet that could all over again.
It's a birthday. It's an excuse to be happy. You think that's lame?
Why are you here? To buy me a pony?
I'm just waiting for the surgery.
Yeah, well, go scrub in.
All right, done. Close her up.
Tumor didn't just walk itself into a bar and order out a double shot of ethanol. Someone shrunk it down.
Sorry, it was very, very wrong.
House is lucky I didn't just close her up.
He tries it again. That's what happens.
I'll pass it on.
It looks like the surgeon got it over. She's gonna have to have some chemotherapy.
What kind is it?
Luke, stop running. If you stop for a second, it's not all gonna fall apart. Give yourself a break once in a while. The fact is, your mum's gonna have an extra drink every now and then.
No, she won't. She doesn't.
Fine. There are some things you just can't fix, that's all I'm saying.
That's how you'd handle it, something like this. You'd just give up.
No. I'd do it just like you. It's an infusion. She's gonna have a drain in her abdomen. You're going to have to check for possible infection.
Lucas Palmero, Trina Wyatt, Child Services, State of New Jersey.
Can I help you? This is a private room.
He's only 15 years old, a minor. He's in a tough living situation. We're just here to help.
I don't need your help.
15?
Lucas, you're gonna have to come with us right now.
Where are you taking him?
Until the determination is made, He'll be housed at Children's Services.
I don't want to be housed. I live with my mom.
Not for the next few days. Come on. Let's not make this difficult.
Mom. Love you.
And that's lost. You remember?
Yeah.
I love you.
Cuddy didn't say anything about pushing Bergen to finish the surgery?
Not a word. Some kind of mind game. She's waiting for me to crack.
Oh, either that or she's just being nice.
Yeah, right.
You said you wouldn't call. You're a real bastard, you know.
Yeah. I get that a lot. I don't think Mom's crazy. For in the old days, though she had young men's praise and old men's blame, among the poor, both old and young gave her praise. You called social services. It was you.
No. No. No.
It's okay, it's okay. I get it. He'll have an easier time dealing with the system. Sure, he won't be with his real mother, but his real mother's sick. Someone needs to take care of him.
I'm not gonna live here.
What would his future have been? Taking you to chemo and back on the bus. And even if the cancer is in complete remission, you'll still have a mother who hears voices.
Talk no more. Talk no more.
Look what I do to him, Limpy. You said that. I checked the phone records. Only one call from this room. Smart. They charge you $2 a call. It was the social services in the state of New Jersey. You're his mother. Couldn't do it to him anymore. Good for you.
Schizophrenics can make rational decisions.
On the small stuff, yeah. When to sleep, what to drink. You know, no lemonade, but I'll take some hemlock if you've got it.
Your man Socrates.
But getting up your son, because it's better for him, it's so sane, so rational. Self-sacrifice is not a symptom of schizophrenia. It excludes the diagnosis.
She's not schizophrenic?
She's 36 years old when she first presents.
It's a little late, but within the parameters.
The internist sends it to a shrink. One shrink sends it to the next. Tells them all she's not crazy. The drugs don't work, and why would they if she's not a head case? She got clearer when I took her off the psych meds. You think I'm crazy?
Well, yeah, but that's not the problem. Didn't we just leave your office?
I like to walk. Is that Dr. Jeffrey Walters? Hi, my name is Greg House. I'm a doctor. Oh, is that the time? Yeah, sorry, my watch must have stopped. Listen, you treated a patient about 18 months ago, a woman named Lucille Palmero. I wondered if you recalled running any tests.
Oh, how terribly foolish of me, Doctor. Is it that late? Yes, I'm calling from London, you see. Must have got my times mixed up, so...
I have a headache. It's my only symptom. I go to see 3 doctors. The neurologist tells me it's an aneurysm. The immunologist says I got hay fever. The intensivist can't be bothered. Sends me to a shrink who tells me that I'm punishing myself because I want to sleep with my mommy.
Maybe you're just not getting enough sleep.
Pick your specialist, you pick your disease. If it's not schizophrenia, what else presents with psych symptoms?
Porphyria?
Madness of King Joe.
What about that copper thing? What's it called? It's genetic. The body accumulates too much copper.
Wilson's disease?
Yeah.
Very rare. Nice. I like it.
If any of us did this, you'd fire us.
Well, that's funny. I thought I encouraged you to question.
You're not questioning. You're hoping. You want it to be Wilson's. Boom, give her a couple of drugs. She's okay.
July 17, appointment with a Dr.
She
Karn.
didn't keep it. She never kept another appointment with a shrink he made after that.
Karn is not a shrink. I looked him up. He's an ophthalmologist. Now, why would you want her eyes checked?
Wilson's presents with cataracts, I think.
Yes, it does. It also causes...
You want to have speed to stay with me?
You get a lot of sleep last night.
How are things with Elise?
Great.
Great?
Yeah.
Unsyllable answers, you're rather out of breath. You're lying to me.
Yeah. We got Ramones. We usually work out. Maybe get some water.
Yeah. That's how you work things out.
Talk. Someone apologizes.
Man, I shouldn't have drank last night. Hey, you mean you apologize?
Yeah, I guess.
How often do you guys have sex? You do it this morning? You did. You did it this morning. Maybe that's why you can't stand up. Huh? Come on.
Elise.
Honey, dehydrated. Do we have anything with electrolytes?
Sleeping Beauty. Wake up. It's an emergency. Fridge is empty. Come on. It's almost 4. Elise. Sweetie.
Call Jacques. Tell him I'm not feeling well.
It's Saturday. I've been to work in 3 days, remember?
Just let me sleep.
Come on. You haven't been out of bed since Wednesday.
Leave me alone.
Come on. Sit up.
No, leave me alone.
Stop, leave me alone!
I think there's something wrong with me. No one can figure out what's actually the cause of it. What?
Husband described her as being unusually irritable recently.
And?
I didn't realize it was possible for a woman to be unusually irritable.
Nice try, but you're a misanthrope, not a misogynist.
What's the first thing you ask the doctor who's referring a patient?
Are you questioning my ability to take a history? What's the primary...
Not what, why?
Diseases don't have motives.
No, the doctors do. Why this patient? What interests you? Give me the chart.
Why?
I found your interest interesting. She's irritable, sleeping 18 hours a day.
What's interesting about that? Hypersomnia is usually accompanied by irritability in depressed patients.
True, but not relevant. She's not depressed.
Hello, she's sleeping 18 hours a day.
Fever. Clinical depression does not cause fever.
She'd be sick and depressed.
She's sick. God damn it, why didn't I think of that?
Yeah, that's what I meant.
Elevated sed rate indicates inflammation.
Hypersomnia and personality changes point toward the brain.
Not the spleen. Thank goodness we hired a neurologist. Brain symptoms. Could this be a brain problem?
No other systemic signs of inflammation, apply not vasculitis.
What about parasites? Malaria, Chagas?
But the patient's never been outside of the United States, especially the tropics.
You mean she claims she's never been outside the US?
Very good.
Doesn't matter. Blood and CSF smears show no sign of parasites.
It has to be a tumor then.
A tumor sitting directly on top of the brainstem that 3 ER doctors, 2 neurologists, and a radiologist missed.
Partridge in a pear tree missed it too. Redo the blood work and get a new MRI with 2mm cuts through the mesoddiencephalic. And check Regal's stepmother's. This Too much sleep usually indicates poison apples. Anything else besides the shortness of breath?
Not really. It's actually just kind of a tightness.
Smoke?
No, never.
Exercise?
8 hours a day. I teach preschool.
Sounds fun. Any history of heart disease in your family?
Not that I know of.
Take a deep breath. Been under a lot of stress lately.
No more than usual.
You're probably just a little anemic. I'm gonna do an EKG just to make sure.
Do I need to take this off?
No, you can just pull that down in front. Good Lord. Are those real?
Do they look real?
They look pretty damn good.
They were a present for my husband's 40th. I figured he'd enjoy them more than a sweater.
That's so sweet. I'm afraid the cause of your problem would be staring us right in the face. Actually, I guess I'm the one doing the staring. Of course, I can't be sure. I like to consult a colleague. He's actually somewhat of an expert in these matters. Can I get a page on Dr. Wilson?
A tumor. We don't know. We're checking just to be safe.
You already checked for that.
The previous MRI had a broader view.
Some tumors are almost impossible to see unless you know exactly where to look.
That means it would be small, right?
Yeah.
You're going to be able to operate. Take it out.
If it's a tumor, there are a variety of treatment options, but there are variables other than just size. Don't worry.
Too late.
Try to remain as still as possible. The less distortion there is, the more detail we'll be able to see.
Well, that's what breasts look like.
Is a lie a lie if everybody knows it's a lie?
Well, if a tree pretends to fall in the forest. House, come on, they're breasts. They're a birthday present, not a philosophical treatise.
Lie number one. She did not do that for her husband. She did that for herself. She thinks if she looks different, she'll be different.
No, she thinks if she looks different, she'll be more attractive, which I have to say.
Not to her husband. Cosmetic surgery, so everyone else will look at us differently. Same reason you're wearing that tie.
Well, exactly. That was going to be my next point.
Last 3 months, same 5 ties. Thursday should be that paisley thing.
It's a gift from my wife.
No, it's not. Julie hates green. You bought that yourself. You want to look pretty. At work. Wilson's got a girlfriend.
Stop. I don't.
It takes 2 department heads to treat shortness of breath. What, do the complications increase exponentially with cup size?
I want an EKG and blood test, including tox screen on Mrs. Exam Room 1.
You're ordering tests to cover your lechery. Interesting.
Very tricky case. You love everybody. It's your pathology.
There were no lesions and no mass effect that we could see.
What does that mean?
It means we're still...
What's happened?
Seizure.
She's aspirating. Suction.
The MRI reveals nothing.
That we were able to detect.
It's not a tumor.
A small glioma could hide from contrast. We could do a PET scan.
Yes, that's how a responsible doctor would waste his time in this situation.
Suddenly, tests and radiologists aren't capable of error?
A glioma not presented on a contrast MRI would have to be smaller than a grain of sand, which does not a gravely ill person make.
It could be just post-ictal disorientation.
We would have seen improvement by now.
Late-stage Lyme disease can cause seizures.
Does the husband care about her?
He hasn't left her bedside.
Boy, also means she doesn't have Lyme disease.
What, love conquers all?
Lyme disease initially presents with a rash. Mr. Clingy would have noticed.
We've looked at everything else.
Did you look at her breasts?
Man,
Could be paraneoplastic.
Do you have any family history of breast cancer?
Her mother died of it.
The brain, but not the brain. Clever, huh?
How can breast cancer cause problems in the brain?
There are molecular similarities between brain cells and tumor cells. Paraneoplastic syndrome causes the body's own antibodies to get thrown off track. They end up attacking the brain instead of the tumor.
So, if you do find a tumor, what do?
We treat the underlying malignancy. Once there's no tumor to attack, there's nothing for the antibodies to get confused about.
If the tumor's treatable.
Exactly.
Ow. I'm sorry, I know it's uncomfortable. The tighter we go, the better the image will be.
They still keep me awake.
Don't worry, it's almost over.
I wish people would stop telling me not to worry.
I'm sorry.
My mom was the same age.
We've been trying to get pregnant for over a year. Guess we're lucky we didn't. A lot has changed since your mom died. Don't worry. Don't give up.
No tumor?
The MRI and the mammogram only showed a few benign calcifications.
It's most likely a small cell tumor. It's no surprise we're having trouble finding it. We should do a PET scan. Start with her lungs, then maybe her bones. Sometimes it presents with no tumor at all.
How can a disease caused by a tumor present if there's no tumor?
It happens. 12% of cases.
And how do you treat it if there's no tumor?
You don't. Those 12%, no treatment. They were too busy looking for the tumor, right till they put the patient in the ground.
What choice do we have?
Treat the symptoms. IV immunoglobulin.
So we're just gonna ignore the tumor?
Eventually it'll get bigger. And it'll be really easy to find. One of you needs to check out where she works.
Why?
Because the husband's not sick.
Meaning?
If it's not paraneoplastic and it is a reaction to some sort of toxin, it's obviously not coming from their home.
Foreman, you do it.
Why are you riding me?
It's what I do. Has it got worse lately?
Yeah, seems to me.
Really? Well, that rules out the race thing. She was just as black last week.
How long has Elise worked here?
3 years. She's my best rôtisseur.
And what's that?
The rôtisseur prepares the roasted meats and gravies.
How do you clean your grill?
La force du poignet. You say elbow grease.
Do you use chemical cleaners?
Ah non, absolument. The chefs don't do the cleaning anyway.
What about pesticides? You must spray for roaches and that sort of thing.
No, my kitchen is clean. No roaches. Non, allez au travail. I need to get back to work.
So the fact that I'm here asking you these questions, it doesn't worry you?
Look at me. I'm here 18 hours a day. That guy practically lives here. He does live here. I use the same detergents for 15 years and everyone is healthy as a horse. Whatever Elise has, she didn't get here. I don't hope she feels better. And I had to get a new rôtisseur.
Where's Ed? He went down to the gift shop to buy a shirt. I told him I'd stay up here just in case he woke up.
You must have better things to do.
I send my laundry out.
You're not married.
No.
Waiting for the perfect guy.
Let me guess. You've already found him.
He threw my towels out the window. That's how we met. Freshman year, Ed came to a party that my roommate and I threw. He spent most of the night on the bathroom floor. He figured I wouldn't notice a vomit on the towels if I didn't have any towels.
I'm assuming he came back the next day to apologize.
No way. I need to track him down. Conflict resolution has never been one of Ed's strong points. Nobody's perfect, right?
I guess.
Oh, my neck hurts.
I've been in this bed for a really long time. I'm gonna do the same test we did last night, okay? Do you know what day it is?
My arm itches.
It's probably a mild skin irritation. I'll get you some hydrocortisone in a minute. Do you know what day it is?
Tuesday, it really itches.
How do I get you that cream right now?
We had some data.
You gave sedatives to a patient who's already sleeping 18 hours a day.
It was better than letting her scratch all the skin off her arms.
She could have got it from a transfusion.
Or I'm just saying she could have got it from a transfusion.
Which she never had.
Okay.
What about toxins?
No, the kitchen she works in is cleaner than some hospitals. But they do serve rabbit fever fits or symptoms.
Tularemia initially presents with a rash or ulcer near the infection site.
Not if she inhaled it. Chopping the meat with the cleaver could easily aerosolize the bacteria.
No, then she'd have respiratory symptoms.
Maybe she ignored it, figured she had a cold.
Rejected Lyme disease because the couple would have noticed a rash, but a wet hacking cough is just going to slip right by.
It's either that or she missed her exit on the turnpike and wound up in Africa.
Okay, two lousy ideas. Unfortunately, they're better than all the other ideas. Tularemia. Bizarre. Very nice. That's why I ride you.
Did he just turn on the TV?
He needs to think.
So this should tell us whether or not she's got rabbit fever.
For a diagnosis of tularemia, you need a 4-fold increase in serum antibody levels. To measure the increase you needed before, all we have is an after.
A single titer over 160 would be a big clue.
That's why I ride you. What does that mean? Even when I have a good idea, it's because of him?
Actually, I think he said your idea was a lousy idea.
It has to be one of these two conditions. I say we take our best guess and just start treatment. We'll treat both.
The treatment for tularemia can cause aplastic pneumonia.
How come he doesn't ride you guys?
He's got a crush on you. He just doesn't know how to show it.
You're a raise everybody.
And the treatment for sleeping sickness kills 1 in 10 patients.
So we start with the safer treatment.
By safer, you mean one that's slightly less likely to kill her.
Foreman got the gang testing for tularemia? Yep, probably inconclusive, but worth doing. So, what's her name? When do I get to meet her?
There's nobody. Give it up.
Your lips say no, your shoes say yes.
Well, they're French. You can't trust a word they say.
Solid, yet stylish. A professional woman would be impressed. I'm thinking accountant, actuary maybe. Somebody in the hospital. Patient? Chemo's not sexy. Daughter of a patient. She would certainly have the neediness you need.
I'm not going to date a patient's daughter.
Very ethical. Of course, most married men would say they don't date at all.
There was no date. I had lunch with one of the nurses. It's her first time in an oncology unit. She's having a tough time, emotionally.
Perfect.
I want it to be nice. That's all. I mean it.
You always do. It's part of your charm.
Hi, boys. Mrs. Campbell's test results. You remember her, the preschool teacher with the heart of silicone.
Nope, doesn't ring a bell.
They came in yesterday. I figured you guys would have been all over them. I know how concerned you were.
She's all upset because we paid more attention to the other girl. You check out her ass, I've got the chest.
The tests were normal. Of course, that's just my opinion. You might want to call a couple of guys from maintenance in for a consult.
You check her EKG results before she left the other day?
You ordered it.
You're the responsible one.
What's wrong? They look normal to me.
Where is she?
Waiting downstairs. Why?
That's right.
get rid of the implants?
Surprisingly, no. But your EKG shows a slightly decreased heart rate.
Is that a problem?
You told me you haven't changed your diet or exercise. Were you lying?
Lying?
Does your husband have high blood pressure?
My husband?
Yeah, I see. If you're gonna repeat everything I say, this conversation is gonna take twice as long.
Yes, he was diagnosed 6 months ago.
You do a lot of cooking at home?
Not really, other than oatmeal in the morning.
Did you happen to notice a slightly odd taste to the oatmeal lately?
Wait, are you saying that
That it looks like your husband stirred in some of his blood pressure medication along with brown sugar?
you think my husband's trying to poison me?
No, nothing like that. He just doesn't want to have sex with you. Decreased sex drive is one of the most common side effects of the beta blockers he's been taking. I'm guessing he figured if you're both frigid, no harm, no foul. Should have gotten in the sweater.
That's ridiculous.
Fine. If you're still concerned about the shortness of breath, I'd start making your own breakfast.
Wait. What should I do?
If you care about your husband at all, I'd do the responsible thing. Buy yourself some condoms, go to a bar, find... Lab tests inconclusive.
Not surprisingly.
No, but too bad. Luckily, I have the answer.
To what?
Thanks for asking. The life itself, sex. Anything that can be transmitted via the blood can be transmitted through sex.
Sleeping sickness from sex?
It's not without precedent.
I'm pretty sure it is, unless you're talking about going to Africa and having sex with a tsetse fly.
A Portuguese man was diagnosed 3 years ago with CNS-affected sleeping sickness. His only connection with Africa was through a girlfriend who'd served with the military in Angola.
Boy, where'd you find that?
The journal of the Instituto de Higiene y Medicina Tropical. You don't read Portuguese?
You do?
Pretty sure that's what it said. Either that or it was an ad for sunglasses.
Her husband has never been to Africa either.
Oh, stymied again. Your logic is bulletproof.
I think ignoring respiratory symptoms is more likely than cheating.
Because?
They're completely devoted to each other.
Because?
They love each other.
Or?
They're overcompensating for guilt.
Find out which it is.
You want me to ask a man whose wife is about to die if he cheated on her?
No, I want you to be polite and let her die. Actually, I don't want you to ask her anything for me. Take the husband, Chase, take the wife.
You don't trust me to do my job?
We all formulate questions based on the answers we want to hear.
And how exactly do you reformulate have you screwed around?
Did you know she's been trying to get pregnant?
Yes.
After you got so freaked about the sick babies a while ago, I figured that was your thing. But you've never been prescribed folic acid to boost baby if you've never been pregnant.
You told my medical records?
You coughed the other day. I was concerned.
You were curious. Like an 8-year-old boy with a puzzle that's just a little too grown up for him to figure out.
Tomato, tomato.
So it's either sleeping sickness or this rabbit thing. They're both fatal without treatment. And unfortunately, the treatment for both is extremely dangerous. Other tests you can do? Not at this stage. But each condition has a unique history. We're hoping your answers to a few questions will help us. Sure. What do we need to know?
Before the sleeping problems, did you have any trouble breathing? The cough that wouldn't go away? Anything like that?
No.
You certain?
Absolutely. I've never been away from her for more than a night. If she had breathing troubles, I would have noticed.
The other condition is significantly more likely if you've had an affair.
Have you ever had an affair?
Of course not.
You sure?
I think I'd remember cheating on my wife.
You might be reluctant to admit it.
No.
I just want to be perfectly clear. If your wife has sleeping sickness and we don't treat her, she'll die.
I would never do that to Ed. I love him.
Absolutely not. I love her.
then. They say no cheating, we cross off sleeping sickness. Any new ideas? Okay, we go with Foreman's toluene, starter on IV chloramphenicol, 25 milligrams per kilogram 4 times a day. Good night.
Where's Ed? Right next to you. Oh, you're 2 down, 2 to go.
2 days.
No doses. You have about 20 more days of this fun. About 4 a.m. I pulled the short straw. Flow rate looks good. Where's your flushing? What time is it? 4 a.m. Do you not remember just asking?
I don't know.
Elise? 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 Elise?
What are you doing?
Trying to wake her.
Fall asleep again?
Remember the sentence. Elise? Elise?
What's happening?
Patient's not responding. Pulse is fine. Airway's open. Check her blood pressure. Pupils are reactive.
Elise, wake up. You gotta wake up. What does that mean? What are you doing?
She's unresponsive to pain. Come on, Elise.
She dying?
No. She's in a coma.
There's only one way a tularemia patient goes into a coma while on IV chloramphenicol.
The patient doesn't have tularemia.
And then there was one. Patient comes in because she's sleeping too much. It takes 10 doctors in a coma to diagnose sleeping sickness.
And then there was none. We still have the problem of explaining how a white chick from Jersey who's never traveled south of D.C. has African sleeping sickness.
The obvious explanation.
I made it clear. This guy's lying about sleeping around. He knows he's murdering his wife.
Does seem unlikely. Go away.
What are you doing?
Checking for lymphadenopathy. I'm waiting for you.
Who are you?
I'm Dr. House. Her wife has human African trypanosomiasis. Sleeping sickness.
You mean it's not tularemia? A virus, tumor, or cancer?
Nope.
I've never had an affair.
I believe you.
And I trust Elise.
The treatment for this disease is a drug that's fatal on its own 10% of the time. Which is why I need your written consent before I can legally prescribe it.
Why would she lie if she knew it could kill her?
I don't ask why patients lie. I just assume they all do.
But why?
To protect you, because she didn't think it mattered. It just seemed easier because that's what people do. If you're absolutely certain that your wife has never had sex with anyone but you since you were married, then I'm wrong. But if you think there's a possibility that just one time she wasn't perfect, one weekend you're out of town, one fight where she ran to a friend, one stupid Christmas party, you need to allow me to start treatment. Because if we don't, she's going to be dead by tomorrow morning. You trust your wife that much?
I don't know.
syringes?
The special IV tubing.
Why do we need this stuff?
Because Millennium melts plastic. This stuff's basically arsenic mixed with antifreeze.
It doesn't kill us, makes us stronger, huh?
Nietzsche wouldn't have been so glib if he'd been prescribed Millennium.
Can cause vomiting, abdominal pain, blood toxicity, neural damage, cardiac arrhythmia.
I forgot to say it's gonna hurt like all hell.
She's lucky she's in a coma.
Long before we know if it's working.
To say, it's a good sign that she hasn't gotten any worse.
Does she even know I'm here?
She knows you're always there for her.
If she gets better, it means she wasn't always there for me.
It means she made a mistake.
I can't help it. Part of me, big part of me, can't handle that. Doesn't want her to get better. So it'd make me a terrible person.
Yes.
So you're treating her for African sleeping sickness because you don't think it's possible for someone to be faithful in a relationship?
And you do.
Yes.
And you need to tell me that.
Look, I'm not having an affair. I had lunch with someone I work with at work once.
I believe you. What I don't believe is it would be just once.
I love my wife.
You certainly love saying it. I'm sorry, I know you love your wife. You loved all your wives. Probably still do. In fact, you probably love all the women you loved who weren't your wife.
You can be a real jerk sometimes, you know that?
Yeah, and you're the good guy.
At least I try.
As long as you're trying to be good, you can do whatever you want.
And as long as you're not trying, you can say whatever you want.
So between us, we can do anything. We can rule the world. Mixing up some margaritas. Mine's a double senorita. That's Portuguese, you know.
Spanish.
Uh-oh. What's going on?
I'm recalibrating the centrifuge.
Turn around. It's a very sad thing. An uncalibrated centrifuge makes me cry too.
I'm not crying.
Okay.
I told the husband he was a jerk.
What?
When I was in college, I found out that I got married. And
At that age, the chances of marriage lasting.
it lasted 6 months. So I heard cancer metastasized to his brain. There was nothing they could do. I was 21 and I watched my husband die.
I'm sorry. But that's not the whole story. Just
symptom, not your illness. Thyroid cancer would have been diagnosed at least a year before his death. He knew he was dying, but he married it. Must have been when you first met him. Did you marry him anyway? You can't be that good a person and well-adjusted. Why? So you wind up crying over centrifuges.
Or hating people.
The fever spiked at 104. Echo shows global hyperkinesis. Blood pressure? Barely 90 over 40.
The dopamine?
Started 270 micrograms per minute 10 minutes ago. Still no change. Killing the parasites isn't going to do much good if we kill her heart at the same time.
The heart can be replaced. The brain can't.
Right now, we'll kill you both. If she's going to die, we should at least let her do it without that acid flowing through her veins. What's happening?
We would have expected your wife's condition to show some improvement by now. And it hasn't. It's going the other way.
Dad. He's away. She's gonna be okay.
Yeah. Sure. What are you gonna do? Were you always honest with her? You know how lucky you are. Your wife is alive. She loves you.
She did. Love a person and do that to them.
She loves you.
I need to know who you had the affair with. He has to be notified so he can get treatment as well.
did you lie to us? You knew your life was at stake.
Coming back, is he?
We all make mistakes. And we all pay a price. I need that name.
Hey there. How you doing?
Fine.
Do you know where your dad is?
Can I help you?
Eyes on your work. You all right? What is going on? Get some help.
The kid was just taking his AP calculus exam when all of a sudden he got nauseous and disoriented.
That's the way calculus presents.
Severe bradycardia. Heart rate's down to 48 and falling fast.
You know the kid?
No, he just came in.
Mom, real good looking.
I didn't notice.
Then it's a mystery. Not why he's sick, but why you care so much. Gift job's open, buy him a car.
He's not responding to atropine.
Boys love fart jokes. Find one with a good fart joke. He's a teenager. It's drugs. Tell those ER geniuses to give him charcoal and naloxone. Stop following me.
His tox screen was negative. He's still whacked out.
You don't care about the kid. You just find his illness
His
intriguing.
CAT scan was clean. There's no sign of an infection. It's not diabetes.
And you don't care about him.
That's what you want to hear. Not in the slightest.
Me neither. Things will be objective.
Maybe it's shigellosis.
Wouldn't account for the bradycardia.
Fibromyositis wouldn't account for the whacked out. So, what's the differential for negative tox screen?
He was clean.
Well, someone screwed up the test.
That never happens.
Or he OD'd on something we didn't test for. 1,4-butane diol would give you these symptoms.
That's new.
Copy machine toner. Same punch as GHB. A little pricier, way more dangerous. On the other hand, it is legal. I want you to go to his house and find his stash. I'll let you know all the good hiding spots.
Actually, I never did drugs.
Better go with him in case he gets high. How much atropine is the kid getting?
1 ml.
Make it 2, in case he needs his heart later on.
Matt, did you take any drugs this morning?
Sit down.
You squeeze
Twist my fingers for me. Did anyone give you anything to help with the math test? Matt?
I told you, he doesn't take drugs.
Miss Davis, all parents think that about their children. And they're usually wrong.
I gave my mum a little trouble when I was his age. I turned out okay. Even she thought so.
I know my kid. The fact that you did drugs doesn't mean he did.
Did he go anywhere last night?
No. He was home studying.
Any friends come over to help him?
And bring him drugs? Is that what your friends do?
Miss Davis.
Look. I tested him myself. Home kid, I took some hair off his brush. I didn't want him to know about it because I do trust him.
Then why did you test it?
All he did last night was study and argue about his college interviews. He wants to be himself. No haircut, ratty old clothes, that'll go over big. And we both gave up and went to bed, that's it.
Has he ever had any problems like this before? Any family history?
No. It's just me and him.
Guys, about 10 minutes south.
Right, let's go.
Seizing.
This room is way too clean for a teenage boy.
You know why House thinks I'm a druggie?
This is gonna be a racial thing, isn't it?
Same reason he thinks his kid overdosed. When you're a drug addict, you want to believe everyone else is too.
He's not addicted. He has to take drugs.
The definition of an addict.
He's in pain.
And addicted to painkillers. What a coincidence.
You really never did any drugs?
Now this is going to be a racial thing.
Oh, deflecting a personal question to joke. You might know that does that.
Yeah, I'm just like him. Except for the angry, bitter, pompous cripple part.
We should all pitch in and get you a nice cane. We already have the magic gym shoes. Check this out.
Mom's not too careful with homemade tomato sauce. The top sticks out like that. It's a sign of bacterial contamination.
She's open.
I am extremely disappointed. I send you out for exciting new designer drugs, you come back with tomato sauce. But you paid twice as much. I got mine on the line.
Matt decided to make himself a homemade pizza for a bedtime snack.
So some botulism, as well as a million other toxins that cause gastroenteritis, cardiac symptoms, and mental confusion.
I'm so sure about gastroenteritis, but mental confusion. Bring it on. Delicious.
Did you have a death wish?
So you didn't try to save me.
I figured you were trying to make some kind of setup.
It was. Kid just started seizing. Not a symptom of foodborne toxins.
Also not a symptom of drug use, not 2 hours after admission.
Don't make him sneeze. In addition to all his other delightful symptoms.
Pesticide poisoning.
Carbamates.
Or organophosphates, organochlorines.
Inhalation or absorption.
Too soon to tell.
You should wash it down. The poison can still be on his skin.
Already told the nurses.
I feel good.
That's your complaint. Your major symptom.
I told you this was a waste of time.
I notice colors move. And music. I'm really hearing music. I'm 82, and I'm supposed to be playing canasta with the other old ladies, but now, when I see a guy with a cute butt, I can't stop looking at him. Or
sexy beard.
And you figured that enjoying cute butts is a sign of disease.
It all started a month ago when Mark rented Gone with the Wind for me, but it had the wrong DVD in it.
Oh, right, I forgot. This is all mine.
But of course, I was too busy to bring it back.
Look, I don't have a life.
So I watched it, and it had this actor in it, this kid called Ashton Kutcher. Now, I think about Ashton all the time. All the time. You remind me of him. Same bedroom eyes.
We're always mixing us up.
I suppose you need to check.
No. That would be necessary.
I told you.
But I am going to admit you to the hospital for tests.
What test? She's just old.
You're just insufferable. Mother has had a sudden personality change. You should be checked out. The nurse coming in every week. Too handsome to do paperwork.
He's been on this medication for over an hour.
Polydoxine is very effective. It just takes a little time for it to kick in.
And maybe you're wrong. Maybe it's not a pesticide.
The blood work was pretty conclusive. It's an organophosphate.
We're at 30. Ready, cardiac arrest. Get me the pen.
What are you doing?
We'll get a baby's heart for it. Set it to 60.
Stand this anymore.
We'll keep him on the pads for another hour.
And what?
Let's see what happens.
Well, that's not my philosophy. Especially when it comes to my son. And if something bad might happen, I'd like to know what our options are.
The polydoxine isn't doing him any good. You're gonna have to wire his heart.
They were wrong about the pesticides.
I ran his plasma again twice.
Are there any stronger treatments for the organophosphate poisoning?
Oh, damn it, you caught me. Doing weak stuff. Just trying to save a little money.
Actually, one of my professors at Columbia developed an experimental treatment for the art.
What's the success rate?
They're targeted. There's a different hydrolase treatment for each poison. We need to know if Matt got this with Orangine or
What's the
Malchior.
success rate?
Excellent, I'm sure. The U.S. Army, be all you can be. Point is, what are the kids' chances without it?
Minimal at best. The poison's broken the blood-brain barrier.
I assume minimal best is your stiff upper lip British way of saying no chance in hell.
I'm Australian.
You put the pool in your money. You're British. Call your professor.
If we don't know what kind of organophosphate we're targeting, we don't know which hydrolase to ask for. There's over 40 organophosphates.
Get all of them.
Great minds think alike.
By the time we get here, we're gonna know which one we need.
If we figure out how he got exposed, we'll figure out what he was exposed to.
Well, Mom had homemade tomato sauce. Call me crazy, but I think maybe homemade tomatoes.
Front yard vegetable garden.
Kids out there spraying, sees a pretty girl, hormones raging, spray can goes out in his face.
I'll check into it.
Make the call.
I'll keep the kid alive. For a while at least.
I don't have lunch.
Security being a cable.
Yeah.
I found the pesticide. It's diazophoton. And it's Eddie. He used it the whole camp.
The poison's called diazophoton. This should bond with a